If a person gets up from the couch and doesn't feel anything, I won't take a penny from him.
How did you learn this?
The most upsetting thing is, aren't you going to break me?
His neck cracked and he had a stroke the next day.
Put simply, the vertebral process breaks with just a thumb.
But can this be fatal? The question is about deadly outcomes.
At 13 months, he spilled boiling water, fell into a coma, and was clinically dead for 48 seconds.
Are there really no healthy people at all?
No manual therapist can remove a hernia by hand.
Hello friends, another podcast, but this one is special. Today we have my friend Uncle Seryoja as our guest. He asked to be introduced that way. So today we have Uncle Seryoja.
Uncle Seryoja is our guest.
At Uncle Sasha's. Today I invited a few of my friends to the podcast. He already corrected the introduction for one of them and another one will arrive soon. That's because they were such doubters. One of them has already been convinced. I also checked myself before coming here. Friends, you asked me to invite him, so I did. Let's get to the questions. So tell us, how did you learn this?
Learn? Yes, I had to study it all. The first factor is health. When I was 13, I lost the use of my left leg. Not completely. I didn't lose all biomechanics, but my stability was affected. I practiced martial arts, I did karate, I lived for it since I was 7 years old. In 6 years, I reached quite a high level, and during a competition, I got into my stance and my left leg gave out. I couldn't push off, started to panic, got knocked down by everyone, lost the fight, and my mom asked, "What happened?" And I realized I was panicking, I was in shock, I couldn't stand up, I could put weight on my right leg, but not on my left, even though I could still move it. We went to the hospital, got a magnetic resonance imaging, and learned that 70% of my lower back was degeneratively destroyed. They said I would be completely paralyzed for 6 months.
Now many people will probably say, yeah, he's making it up with that kind of thing, and now he's just sitting there like nothing happened.
I'll explain to you now why. Yes, I'm not just sitting here like nothing happened. I just have to. While I was studying, and as I managed to do it fully, I'm still studying it. I want to understand it so I can help others. I basically retrained my brain for biomechanics using my core muscles. My back and leg hurt every day without relief. Sometimes the pain is so intense that you wake up thinking about ending it all. I've gotten used to it, and it has lessened a bit due to my psychological state. So I started to study this, started to learn, read literature. Well, I'm 13 years old, so I either give up and become disabled, or I fight. Well, I've been fighting all my life. Maybe martial arts gave me some motivation, so I started to study. Then I finished school, somehow managed to get around, but the doctors just gave up on me and said there was complete paralysis of the lower body.
So I decided on my own.
Yes, they suggested doing surgery with a complete replacement of the lower back. Well, can you imagine Vibratat, first of all? What kind of... Well, it would have to be replaced, and that either immediately leads to a decrease in height, a growth factor. I'm not tall since 36% of my body is burned. At 1 year and 1 month old, I spilled boiling water on myself. I was enjoying life, but the accident affected my growth factor. They told me there was about a 5% chance that my body would adapt to prosthetics, and a 5% chance that I would even be able to walk after that. I realized my right leg works, so I'm grateful for that. I started studying all of this, then after school I enrolled in the 19th Medical College, graduated from there, and then went on to university to become a neurologist. Everywhere I focused on one main factor. At the same time, I was also studying massages. I ended up learning 11 different massage techniques. And honestly, speaking for myself, the most effective one is the lymphatic drainage, the classic relaxing massage, because all the others still have a negative factor. If there's pain, it means the central nervous system is irritated and the body can't adapt when irritated. You only feel good during the massage. That's a brief overview of massages. I started studying this again, and after relearning how to walk, I realized having more muscle makes moving easier. So I started studying it after that. Well, after that, or rather, during all of this, I was also studying manual therapy and acupuncture just for myself, to understand how it all works.
Do you have a medical education?
Yes, of course. You're a neurologist. That's right. The main factor is that nowhere is there an emphasis on biomechanics. From the very beginning, I started focusing on studying biomechanics, specifically on movement itself. I wanted to know how this happens. Because why did I lose stabilization when my spine was injured? Well, it turns out that I have a partial nerve injury there. Yes, with compression and everything, I kind of retrained my brain to work through the corset muscles. I studied classical manual therapy, both rough and gentle. Even when I practiced and worked, even when I was still learning, I always felt that something wasn't quite right. That's how it turned out. 3 years ago, when I created anatomical programming, I didn't see it as manual therapy.
We'll get to that later.
Yes, here it is.
Can I interrupt you right away? Yes, there are probably guys watching us right now, and many of them don't understand the difference. What's the difference between manual therapy, for example, osteopathy, and chiropractic?
Explain, well, let's put it this way. Actually, chiropractic is manual therapy. It's just the English name for it. For example, in Europe, you won't find a manual therapist, but a chiropractor.
That's why most YouTube videos are like that too.
They're called the same, but they're more like chiropractic and similar to our bone setting practice.
And osteopathy?
Osteopathy is similar to acupuncture and kinesiology, but finding a good osteopath is difficult. Well, there are effective methods, it's deep acupuncture, where people know exactly where to press to relax a particular muscle. Okay, right, but most osteopaths just, well, people come to me and when they tell me about it, I feel like soon I'll just start sitting down myself. A girl told me that they made her lie on her stomach and started hitting her with a whip, saying it was osteopathy with a whip, she said. That I'm beating your soul into you, your own soul. Well, I just shrugged and said thank you that I didn't do any harm. Because I'm never going to judge anyone, because what's the point of judging someone? Well, that's my worldview.
Alright, so let's talk about your treatment methods. What kinds of methods are there in manual therapy?
Look, what we have is manual therapy. It's everything related to the body. It's movement. Movement that's prescribed and directed by a specialist for the patient. We have rough, hard methods, for example, bone setting, where they only work on cracking without working on the muscle fibers. And then there are gentle methods, where the focus is first on massage and then on gentle traction movements, very soft adjustments. But actually, that's very rare because most people still combine, sometimes using hard techniques, sometimes gentle ones, so even with hard movements, that's what happens. We also consider body angles, which many people ignore. They adjust the neck harshly. As I said before, seeing sparks before your eyes means a nerve root may have been pinched during the adjustment, indicating it was done incorrectly. Manual therapy is available, but many now prefer using equipment.
For example, cupping massage.
Cupping massage, by the way, is also actually, well, let's put it this way, cupping massage, which is being done. First, they place the cups, which start to stimulate the temperature of the muscles, and now there are new generations of cups. That's one thing. So
Pressotherapy, that's where the pressure is adjusted. Yes, that's right, up and down.
some cups are straightforward, while others go up and down. Simple pressotherapy involves placing a device on you to stimulate blood flow in your muscles and reduce stagnation. Yes, it's an amazing thing for athletes just to get the blood and lymph moving. Some people use the old school method. Yes, they put a cup on and start moving it around. The gua sha technique is basically the same, really, and the cupping movement is the same thing. Some people use a scraper, some use a cup. Well, with the cup, I think it's actually more effective than gua sha. It's less painful and works deeper. Still, it doesn't quite reach the deep muscles. It's work with the superficial muscle layers. Some people go even further. First, they warm up and apply electrophoresis. Well, magnets, yes, that also works. It's for joint recovery. That's cool, but you need to know how to adjust it for the wave, for the thickness, basically, depending on the muscle, so that the wave actually reaches our target area. Some people also use, well, acupuncture is also manual therapy, right? Kinesiology is also manual therapy, but that's already more of a deviation from it, paki.
What's the principle behind manual therapy?
Is it the specialist's lever movement on the client, on the patient, on the sick person in order to put a certain bone or cartilage back in its place, which were displaced and created an asymmetrical load on the muscles due to their instability?
Then it's crooked, so you straighten it where it should be.
Yes, but there's a small exception. If the muscles aren't activated properly when setting the bones, they remain unchanged. They pull everything back to themselves by privilege, And many people, someone comes in, gets an adjustment, there's a cool crack, he stands up, feels better, but the next day, everything goes back to how it was, because it wasn't done properly. First, distract the brain. We have real therapy and KGB and Federal Security Service agents, some of them older, working.
It's like natural language processing.
Yeah, something like that. We need to program our brain, distract it, and the easiest way to distract it is with food. After a session, any kind of body manipulation, whether it's a massage or lymphatic drainage, you need to eat within an hour and a half.
Is that why you made me eat?
Yes, that's right, because otherwise your brain would use muscle memory to restore things as they were.
What are the main principles and techniques used in manual therapy?
These are tractions.
Let's talk about different conditions, since people come in with different diagnoses.
Listen, 99% of the time it's the same thing.
With what?
See, I work a little differently now. I don't just work with the symptoms, I focus as much as possible on the problem itself. Most problems stem from dysfunction in stabilizer muscles, which keep the spine stable. As you noticed, the change is immediate. You can't just come in, spend a week, and expect to feel something. That's impossible. It's not like someone stabbed you with a knife and you're like, oh, a black mark, oh, I have a knife here. Turns out, no, it doesn't work like that either. Any change with your body should be felt immediately. Most people have the same issue, a stabilizer dysfunction. Once we correct it, they immediately straighten up with aligned shoulders and pelvis, though they often have a deep spasm. They need to be removed, or the dysfunctions or the tightness of the antagonists, the muscles we need. It's the same with the iliac muscle. Yes, the iliac muscle spasms pulls the quadratus lumborum and the lower back, and the person stops feeling in terms of support.
Right now, a lot of guys work at the computer. Everyone writes to me saying they watch me while driving or sitting at work. So everyone is sitting, and there's very little movement. Tell me, what kind of lifestyle should our viewer lead? What are the specifics and what can it lead to in terms of your diagnoses? What problems can they come to you with because of this?
Listen, yeah, with anything at all.
Well, for example,
a shining one closer can drive you crazy. Let me explain why. Look, when a person sits all the time and doesn't move, first of all, it's lymph stagnation, no matter how you look at it, that's the first thing. Then there's impaired blood circulation, that's the second thing. Third, since he's always sitting, his own weight puts pressure on certain points. If his stabilizer isn't working, and nobody's is since they've failed since childhood, that's just our reality. Compression occurs on the spine. If you're sitting on your tailbone, your stabilizer and lower back aren't functioning. That's it.
What should you be sitting on?
On your butt, on your sitting points, on your sit bones, on your buns. Yeah, that's it.
It's uncomfortable for me to sit. Right now, my tailbone is pressing against the chair. That means something's not right.
Your iliac muscle is in spasm. You can release it yourself. We'll get to that. Yes, we'll get to that. It's all very simple. We'll just need to...
Well, okay, a sedentary lifestyle, but that's kind of obvious. But maybe there's something else. I mean, everyone sits, but what else? Yes.
You must move. Movement is life everywhere.
And the lack of basic
physical activity actually doesn't play a big role. Even athletes come to me.
You just need movement?
Just move.
Well, what's the minimum? So that our friend who's watching us right now understands
that even if you work in an office, you should at least walk around the office. If you have a break, right, well, instead of just standing there smoking, walk around while you smoke. Don't just stand still. Get your lymph moving, get your blood flowing.
It's not about the 10,000 steps. Just listen.
You need 10,000 steps to burn off what you eat. No matter how you look at it, that's how it is. So what's the difference? All right, let's walk 10,000 steps. For someone without legs due to a disability, that's going to be difficult. No, well, I don't want to offend anyone in any way. It would be hard for him to do that.
Physical activity, let's say, in the shoulder area. They sit from morning till night, typing on the computer and not doing anything else. That can't lead to anything good.
Maybe, first of all, under the load of the antagonist, yes, for our spine, it's the pectoral and minor pectoral muscles. They get more and more tense. Plus, sleeping on your side during the whole sleep period. When we sleep, we press our shoulder into the joint capsule, so the pectoral muscles get tense, causing shoulder slouching, and the load on the trapezius muscle also increases. That's when the frames age. It's fibrosis of the levator scapulae muscle, putting more strain on the spine since it lacks thoracic support. What does it start to do? It starts to bend under its own weight and tension. When we relieve the spasm, the shoulders open up, we activate the stabilizer, and that's it.
The person immediately straightens up. You mentioned sleep. I was going to ask about that later, but since you brought it up, what's the best sleeping position? Doctors often disagree. For example, I spoke with one neurologist.
The optimal sleep phase. There's an old Chinese rule of 5 wives, and those familiar with it know there should be 5 pillows for maximum comfort. One under your neck, one under your arm, one under your armpit, one under your lower back, and one between your legs. That's if you're sleeping on your side. If you're sleeping on your back, you should have a pillow for your head, of course. You should never sleep without a pillow. Otherwise, kyphotic lordosis may form from strap muscle atrophy.
How else? If you sleep on a hard floor,
A hard floor is fine, but you should still use something underneath. Many people leave out important details. They're like, oh, it's the same thing. Yeah, sure, sleep on the floor. Okay, but you still need to put something underneath. Our floors are cold and hard, making it easy to catch a chill, especially in your kidneys or lower back, so you should put something underneath. Well, you can put a blanket or even two so that you have a point of contact with the floor. But the blankets still provide at least some support for your arches, yeah? That's your lumbar arch, your neck arch, no matter how you look at it.
so there should be several points of support. Of course, the ideal position is on your side, on your back, or on your stomach.
Actually, I think that sleeping on your back is best. If we sleep on our side, we put stress on the lumbar region and compress the hip joint throughout the entire sleep. Yes, because we usually don't move much in our sleep. We're not counting those who do. Yes.
Alternate sleeping sides. Right one night, left the next.
You're still putting pressure on it. Even averaging 5 hours of sleep, that's hours of pressure on your joint. That's the first thing. Second, your lower back. Let's take a person as an example. So, a person is sleeping and their spine, ideally it should be straight, but when they're sleeping, it sags. Can you imagine the kind of pressure that puts on all the intervertebral discs? They're basically under a lot of compression.
I have a really expensive mattress, like very expensive, but I didn't buy it myself, so I can say it's a temper mattress. I don't even know, it cost thousands. A lot. My friend gave it to me as a gift while visiting.
And there was something different, like, your mattress is crap.
Yeah, and it was... Pashalosev, I'll tell you, he sat down and said, your mattress is crap, I'll give you one, but you have to go and try it out first.
That's a must.
So we actually went, tried them out. There were different ones, different technologies, like, look, National Aeronautics and Space Administration used this material to make their seats.
Well, I got it, basically.
So I wonder, is it truly worth it, or just advertising?
That does make sense, because the higher the quality of your mattress material, the better it will be, and it will last longer anyway. Many people say you should change your mattress every 10 years. Is that really true?
Do you know why they say that? It's because dirt and debris build up in there.
First of all, you need to flip your mattress every 3 months. That's a must, because no matter what, during your sleep, if you don't toss and turn, you create a pressure spot.
Mine, for instance, is considered expensive, so there's no need to flip it.
I don't know. Look, for example, do you know what the memory effect is?
Yeah, I do.
For example, if someone prays in the same spot for 10 years, what happens to the floor?
Well, there will be a dent right there.
That's the floor. This is a mattress, and there will be a dent.
Don't twist it, you convinced me. So what health issues need manual intervention? There are always other options.
Well,
Look at yourself, you're feeling it too.
first of all, everyone has problems. I've never seen anyone use the stabilizers, but that's where it all starts. Well, that's according to my method, but if we look at the person specifically, then for everyone, doing this at least once in their life wouldn't hurt. It's like visiting you at least once in your life, even if you feel fine. I believe men over 30 especially should do this.
Listen, with me it's long and expensive, you know? And many people get upset saying, damn, I'm not healthy.
So I wanted to give it away?
Waited 5 months, did tests, I'm healthy. Honestly, it feels a little insulting.
Well, that's great, but what if you weren't healthy? Yeah.
That's good.
It's even better if there are no risk factors at all. Yeah, go get checked every 6 months for prevention. So what exactly are the problems? Let's get straight to it. First of all, it's our habits. Sitting with one leg over the other, standing on one leg while talking, sleeping on your side, and of course, the most common one, sitting on your phone. All of that. As a result, everyone develops these issues. Anyone, even those with perfect posture or knowledge. That's what happens. And if we're talking specifically about pathology, what is it? Pain in the hip joint, yes. Well, if there's acute pain in the hip joint, I always recommend getting a magnetic resonance imaging or at least an X-ray. Oh, ultrasound, sorry. In order to rule out Bacterius disease, if you have it, a manual therapist won't be able to help you because at most, he can only relieve the joint's load.
Listen, can I ask a question? You say there are no healthy people there, come over there, and so on. Yes, that's true, and we're only discussing the positives, but the guys asked the right question. What are the downsides? People come to me for kidney cancer surgery and ask if it's 100% guaranteed. I explain I can't guarantee that. There could be anesthesia complications or even a power outage at the hospital. In your case,
For me, it all makes sense. The human factor and risk are always present, but in my work, especially my practice, there really aren't any downsides. Let me explain why.
first of all,
I'm not doing anything new.
that is, there are no complications, none at all, none. But what about those stories I read, where someone's neck cracked and the next day they had a stroke?
Let me explain. First of all, the crack was rough. I work in anatomy, that's all. First of all, as soon as you lie down,
No, I mean, the question is if you're doing it well.
is it about manual therapy in general? I misunderstood and thought it was just about me and manual therapy. There is a big risk.
And what are the risks?
An unqualified specialist, first of all. Yes, rough technique, lack of understanding of human anatomy.
But that's the reason. And what can it lead to death? You can really die, yes.
As harsh as it may sound, there have been cases when people broke their necks. There have been cases when they broke their lower back. They broke a process. There was inflammation. I had a case in Ulyanovsk, monolithic. You know, a girl was recovering from it for half a year. She couldn't get out of bed, but then she fully recovered.
She came to him with a problem, and instead of helping,
Yeah, she was paralyzed for half a year. I think it was about 5 months. I don't want to exaggerate. It was just inflammation of the spine after the injury.
these side effects occur immediately during the neck adjustment on the table.
Sometimes they occur on the table or afterward. A lot of people come to me and say like, damn, I went to the same massage, went to a rough one, a sports massage, and I got pinched. Something got stuck. For example, yesterday a girl came to me, she went for a massage, her work sent her, there was some blind massage therapist, supposedly very good, and while he was working, she felt it was too rough. He said, don't worry, it's necessary, and kept going, but she got pinched in her neck, pelvis, and sciatic area, causing inflammation and a piriformis spasm from bad compression. I had to relieve everything for her.
You know, my knee too. I had surgery in December, and before that I injured the other one, the left. My right is torn, and now the left is too. Thankfully, my magnetic resonance imaging was fine, so I decided to get a massage. In our building, Thai women give massages but don't speak Russian. Their English is broken, but I still explain myself. I'm showing her, don't touch here, it hurts, don't touch the knee, and Kshuka is getting a massage on the table next to me. I'm wincing because she must have thought she needed to do the opposite and started pressing on my knee with all her strength. So there I am, lying down and thinking, well, maybe she can feel something with her hands and knows what she's doing, so I'll just endure it. That's what happened with my knee.
I knew you would say that because she was increasing the blood flow with compression, but she was actually making it worse. And of course, you have swelling. You have an inflammatory process going on.
So the question is, how do I know? I'm not a doctor. How do I figure it out? I'm just an ordinary guy sitting at home. Something hurts somewhere. Something's pinched. How do I know that I need to see a manual therapist and not an osteopath, not a surgeon, not an orthopedist, not a shaman? How do I figure out that I specifically need a manual therapist? What are the signs that I need this particular specialist? Because imagine, as far as I know, your waiting list is about 4 months. Our podcast doesn't need advertising. It's just genuinely really good. That's how it is.
Listen, that's a very good question. First of all, many people, when they feel like they have mobility issues, whether it's the neck, shoulders, back, or lower back, and it's constantly aching, they just write, I want to come to you just for that. Well, I call it that, yeah, a technical inspection. Basically, I don't really consider myself a manual therapist, and I actually prefer the term biomechanic because that's why people come to me. I just fix everything quickly and that's it, goodbye. No, none of that, like 10 sessions and so on. So people, many ask, how do you determine that? Yes, by how you feel. If you feel like you can't bend over, or when you're tying your shoelaces, that's the most common example. If you can't wash your hair for 15 minutes in a bent over position, sorry, but that means you already have problems. It means your lower back isn't working. It means it's impaired.
If, for example, it's uncomfortable for me to sit with one leg over the other or in another position,
Men shouldn't cross one leg over the other because it compresses everything and disrupts blood flow to the prostate and testicles. The same applies to women. And that's not even the main factor. There's also the tightening of the iliac muscle, which actually weakens the stabilizing function even more. A person starts sitting on their tailbone. A lot of people come to me and say, oh, my tailbone hurts. I tell them, you're sitting on it. You've been sitting on your tailbone for years. Of course it's going to hurt because that's how you sit on it. We're not even talking about extra weight here, just an average person with normal weight. How do you figure this out? Who should you go to? Well, a lot of people just do it simply. They see something, they want it, and they come in.
You have a 4-month wait list, and I'll explain why waiting that long may not be best.
But it was never the wrong place, honestly.
Are there really no healthy people at all?
No, how is that possible? We're specifically discussing pathology and physiology. I mean, someone who's physiologically healthy.
I'm sitting here, nothing bothers or hurts me. I understand, like with oncology.
Oncology is the scariest thing.
I get it. You might not feel anything, but if I had a real issue that needed an osteopath, wouldn't I notice something? So why go? Mainly for prevention.
Prevention, yes. First of all, prevention is important. As I already said, just like with you, yes, people should really go once every 6 months, just once if someone tells you that you need a course of 10 sessions. Well, in this case, it's either a question about the specialist and their work, or, well, they're just trying to make money off you. And the thing is, if nothing bothers you, that doesn't mean everything is fine. Maybe you just got used to it. Our brain knows how to do things like isolate a problem. We get used to things like cockroaches, PO.
I agree. My patient fills out questionnaires, and when I ask about them, they say, why? I already wrote it down. Or, why send audio if you want me to tell you? Why not tell me? The questionnaires, audio, and what people say often all differ. This morning, a patient came in for a consultation and sent a quality of life questionnaire. Everything is terrible, just awful, like it's an 80 out of the worst possible score. I ask, how are you doing? Yeah, everything's fine, everything's okay, everything's good.
This is already psychology at work. Many people are afraid to admit that they have problems.
Or maybe it just developed so slowly and smoothly that he already forgot what normal is.
Well, you know, nowadays the concept of normal is really distorted, really distorted. Even during Soviet times, the Soviet Union had entirely different norms, behaviors, and lifestyles.
A question from the subscribers. What can you expect from the first and possibly only session?
If the specialist is good and knows what the problem is, he will fix it.
Right in just one session.
Well, if it's a vertebra displacement without complications, he fixes it, he puts the vertebrae back in place, and that's it, the person is fine. Like, I fixed your neck, for example, and now it doesn't bother you anymore. Well, that's just an example, I'm just a living example. If your legs have been straightened, they're all even now. People come back to me a year later, and their legs are still straight. It was just a regular compression of the hip joint, the joint capsule due to dysfunction of the stabilizers. It just wasn't fixed properly in the joint capsule, and that caused compression. Well, that's an example for you as well. Dear friends.
The topic we're discussing is
It's very unpleasant.
They'll start writing nasty things to you right away.
Oh, I'm used to that.
I take it in strides so you know how I feel. Sometimes books describe things differently from what I see every day in practice, so I always compare what's in the book with real-life experience. They, of course, can be very different, really, completely different. One is nothing like the other.
I agree. Also, looking back, what effect should there be? Let's put it this way. I have a rule, yes. If a person gets up from the couch, looks in the mirror, and doesn't see any difference and doesn't feel anything, I won't take a penny from them because that means I didn't help the person.
It won't be like in that movie, The Big Lvivsky, with the weeds, where the money is Lvivsky. No, where the changes are Lvivsky.
You know that has never happened even once.
All right. Then here's a question for you. He says, okay, let's not take the situation where he's complaining, where his horv is above the back of his head, but let's take the situation when he comes in and says, for example, that nothing is bothering him. What other diagnostics do you use beyond listening to complaints to decide what to check?
First of all, I look at his body and explain to him what's wrong because it's visible. And if you take a person and draw 3 medians, 3 lines, you can see the whole tilt. These are the shoulder girdle, the pelvis, and the knee. Everything can be seen by them.
And you check to make sure everything is in place?
If it's straight, there are no complaints, right? But even if it's straight, issues like kyphosis can still occur, which is the same stabilizer dysfunction.
What other tools do you use for movement diagnostics beyond having them throw, lift, and move left or right?
Lift the left or right leg, especially at the end of the session, if the sciatic nerve was pinched. We do this before and after relieving it, before sending the person home. I need to make sure there's no problem because I'm a perfectionist to the core when it comes to this work. I need to do everything perfectly. I watch as they lift and check for pain. None. Bend over, any pain, no. Turn around, any pain, no. That's it.
As you do this, remember these aren't your patients and you don't know everything, even if people here think you do. Manual therapists use hands, surgeons operate, therapists prescribe pills. Those are just stereotypes. My friend, after examining you, you need to see an orthopedist.
Yes, that's necessary. For example, if I see someone coming in with shoulder issues, I look and see, well, there's a tear in the shoulder capsule, or the labrum. Yes, I say, where did you come to? You need a surgeon, go get a magnetic resonance imaging of your shoulder right away. I say, raise your arm, and yes, it doesn't go up.
And how do you know it's not just something pinched? Well, the biomechanics are different, the movements are different. For example,
Well, with a pinched area, yes. If it's blocked, the movement goes a little bit forward because of tightness in the front deltoid and pectoralis minor. It blocks the lifting of the joint, for example, the rotational lift of the shoulder. Yes, that's how it will be. It's something like that because the pectoral muscle will spasm and won't let it move. But when there's an injury, for example, the person will try to lift from below like this and won't be able to raise it because the muscle isn't working.
the question is why manual therapists? We doctors have this too, but it's not as intense. Among you, one manual therapist hates another, a manual therapist hates an osteopath, and all this rivalry goes on around each other. You don't really do this, but for some reason, a lot of people come at you. Someone uses a rougher technique and calls another an idiot, then the other responds the same way. Why does this happen?
First of all, it's the human factor. Everyone wants to be better, everyone tries to show off. You know yourself, it's the schoolboy syndrome. But honestly, I'm not trying to judge anyone. Yeah, when there's some crazy stuff going on, I just say, well, that's messed up, that's really wild. Thank you for not hurting or killing anyone and for being alive. But that attitude of thinking you're the coolest and know everything isn't possible. First of all, in some areas, one specialist really can be better than another, that's a fact. Just like doctors, everyone here has their own worldview and work styles, so not everyone is the same, and unfortunately there's negativity among colleagues. Instead of sharing, everyone tries to put in their own 2 cents. This is nonsense. Yeah, what are you saying here? But okay, come over, let's talk, explain. But often spend 2 hours from one city, tell me what the problem is, and so on. You know, two dogs bark at each other over a fence. I think that's what it is, but that's not necessary. We need to be kinder to each other. Okay? If you see that someone is doing something wrong, just write to me, say, listen, bro, like, you're an awesome specialist, but please reconsider this move because you could cause harm in this way. That way, just send it if you see it. Or come to his session, that's just an example, and explain. I don't interfere there because every specialist, but I hope that everyone is trying to help.
I watch trust techniques on YouTube, manipulations, thrusts, and jerks. If I try to crack something myself after watching basic movements, is it worth it?
Well, look, it all depends on the angles, on certain movements. About cracking, let's put it this way. Cracking in the body is normal as long as there's no pain.
So if it doesn't hurt, you can make it worse.
If not, look, see, I just cracked my joint and I didn't have any pain. If I did, then I would need to urgently get a magnetic resonance imaging or an ultrasound of the tissues to see where the problem is. In 2000, a Japanese scientist, possibly a surgeon, ran a 12-year experiment cracking only his right hand.
Yes, I read about that. So
After 12 years, he did.
And magnetic resonance imaging after another magnetic resonance imaging.
Both palms are identical, so like the cracking, yeah, crack them, go ahead. I always say when someone comes and says, my kid cracks their joints, I'm like, well, that's fine, I crack mine too, so. The main thing is that there shouldn't be any pain. If there's pain, it means either the person pinched something or, well, did it wrong. Let me put it more clearly. Crack your joints, but do it carefully.
What if I want to stop the urge to crack my joints? My neck was adjusted, and after a few sessions, I stopped cracking it after 4 years.
That's because you had a misalignment in your cervical spine. There's also a psychological factor here. It's like a neurosis. Some people can't stand still. They just need to crack their fingers. It's already a neurosis.
And how do you stop cracking altogether?
In general,
He didn't want to crack his neck, and he's fine. So you need to fix the problem, unless it's just neurosis.
But if it's pure neurosis based on psychology, then you need to see a psychiatrist or a psychologist.
And if you just look at it as a habit,
That's the same thing.
that means you won't be able to just tough it out.
No, it'll drive you crazy. You either have to distract yourself or redirect your thoughts, but you'll still want it. You'll still have that craving.
Wants to crunch a cigarette?
I wish I could smoke right now. Well, that desire is always there because you feel like everything's fine, but as soon as you put it on the table, it gets easier. Your brain still gives you a signal that something isn't quite right.
Why am I asking about self-trust manipulations? Back in school or university, people would say, "Hey, fix my back," and we more or less knew how to do it.
Thoracic traction.
Of the spine, I do it, or someone does it for someone else. Is it worth doing this, or should you just listen to yourself?
Yeah, in general, let's just be honest. Yes, that's my point of view. If you understand that there's strength there, that strength is actually used, that angles are used, then you can... Well, the main thing is not to be reckless, because some people, they pull so hard that the first thoracic vertebra slips out, and that's it, the person gets stuck.
I used to go for massages. I have a good massage therapist, but sometimes when we greet each other, he does this thing to me. He cracks his fingers when discussing massage, but only cracks the thoracic spine during a massage if needed, not just by having you put your hands behind your head. I remember it used to be easy for me, but now it really hurts and I can't do it anymore.
That's muscle tone. It's the tone of your back muscles. Because your thoracic stabilizer hasn't been working for a long time, you were doing wrestling, and your growth was going to the wrong muscles, to the helpers instead. Because you always tried to stand up straight after surgery, you overstrained the synergist. This caused tone and reduced mobility, but mobility returns easily. It's a normal process. Your homework is to lie on a roller for 3 minutes before bed. Roll up a towel, place it under your head to support your head and neck, and keep your neck relaxed. This is important. Some people just rest on it.
That is, we place it under the neck.
No, we put it under the shoulder blades. It's just very...
One roller.
Roller. In the photos, many of us have a towel or small blanket under our heads, depending on preference.
Your head, depending on the spot.
Position it at the occipital part. This relaxes your neck, which in turn relaxes the deep back muscles. There are 3 support points: the head, shoulder blades, and the roller. The back stretches under your own weight, relaxing and lengthening the spine and especially the deep back muscles.
I tried it as you recommended to me back then. I'll even say that at first, when you lie down straight, it's hard to stay like that. Of course, it actually hurts.
Well, what kind of roller do you have? How many centimeters is it?
Well, it's big, like this one, here.
Good point. I always suggest 8 3½ inches regardless of your flexibility, even if you've practiced yoga your whole life. Of course, 8-9 is for you, but you won't feel it. Let's take 14-8-9 is for an average person with reduced spinal mobility and deep muscle tone. We lie on it for the first minute. Sometimes that very first minute can feel unbearable. When? Because our muscle fibers begin to stretch only after, but the deeper ones after about 3 minutes, 2.5 to 3 minutes is enough to stretch the white fibers and deep muscles. Yes, some people stretched for 95 seconds and assumed it was enough, but they only stretched the surface layer. The deeper layer is still in spasm and there's still water there.
I don't drink much. Some people are the same. They just don't like it, can't get used to it, or their jobs don't allow it. Tell me, what can a lack of fluids lead to, based on your own health issues?
First of all, it's osteochondrosis.
Any activity?
Actually, of the entire spine, let me explain why. In fact, osteochondrosis is just the usual dehydration of the spinal discs and really of our whole skeleton. When a person doesn't drink water, there are things in the body called vital organs. Our heart, stomach, lungs, intestines, brain, everything. So if you don't drink water, your body will fill up with fluids taken from your own reserves. First of all, it's your bones, skin, nails, hair, teeth. If you don't drink, you're basically consuming yourself. Things go wrong from there, and many problems occur simply because someone doesn't drink water. Also, lymph stagnation occurs, which affects the immune system, blood viscosity increases, and hematocrit levels rise. No matter how you look at it, because a person doesn't drink water, they start to feel worse anyway. Water is unique among all liquids. It's the only true water. Everything else is just another liquid. Swiss scientists, or maybe Swedish, I don't remember, found that 40 milliliters per kilogram of body weight minus the percentage of fat is the daily norm for everyone. So, let's say you weigh 100 kilograms and you have 15% body fat.
That's 4 liters less 15% body fat.
That was the simplest way to explain it clearly, and that will be your daily requirement.
The question of visits is to protect our subscribers from scammers, either when they're being scammed for money, and right now there are a lot of people who are just out to scam for money. As for what to expect from the first session, you and I basically decided on the solution to your problem.
Well, at least a feeling of change right away, immediately after each action. When I work, if you noticed, yes, just as a fact, I say pay attention to the changes here, pay attention to the changes there. Why do I do this? First of all, so that the person actually pays attention. Because of this, he develops a much better neuromuscular connection during changes and adaptation, because sometimes you go to a specialist. Yes, you just cracked something there, did something. You wonder what changed, but you can't figure it out. Things feel a bit easier, but you don't know why, since the neuromuscular connection wasn't formed. About what exactly should be done, yes. How can you protect yourself from this? There's really no way, unfortunately. You come in, and if someone helped you.
If they instantly say you need 10 sessions, that's unusual.
But that's not normal since the person sees no trend of change.
You can check and return later, but there's no set number of times for this.
There's an adaptation period, let's put it that way. An adaptation period for stabilizers, which I work with in Accent. Yes, for them it's almost 3 to 4 months.
So after the session, you shouldn't come back earlier than 3 to 4 months.
It lasts for 3 to 4 months. Yes, there are cases when something gets pinched during a workout. Well, as I like to say, when the rooster bites you in the ass, anything can happen in life, you can't rule out the human factor. People come to me after 3 or 4 months. Some ask if they can come sooner, like after a month, but I say it's pointless. I tell them, if you want to come more often, just give me your money. And still,
If someone insists you need a set number of sessions or weekly visits, they're likely scammers.
not necessarily. You see, here the focus is on the way they work. I'm not saying they're immediately a scammer. Maybe they just work differently.
It's something to think about.
Well, you shouldn't pay for all the sessions at once, under any circumstances. At your first session, you notice some change, but the problem remains and symptoms have only slightly decreased. Great, that's already good. It means it's a good sign. It means something is working after all. You come to the second session, and if after, say, 3 sessions, yes, there's no more effect, the effect doesn't change, it won't change after 5 sessions either.
What is the average cost of a manual therapy session? For example, in Moscow, with a more or less decent specialist. Not with you, I mean. On average, it's about 8,000.
Some charge more, some charge 20, but the average is 8.
Well, that's cheap.
Well, since you still come in, it's 10 per session here.
Although it's cheaper.
I kind of charge very little because I believe that health should be accessible. Well, I mean, you come in, fix the problem, that's it, you leave, everything's good.
There are limitations. For instance, if someone has an illness or is on blood thinners, I would refuse to operate for a valid reason.
He has wings.
Decompensated diabetes, I would refuse the operation, and you...
Pregnancy is an immediate no. The term doesn't matter because you never know what kind of reaction a woman will have to anesthesia. It could cause a miscarriage. Absolutely not, sir.
How soon after childbirth can it be done?
I recommend waiting at least 3 months, let everything heal. Excuse me, a person just came out of you, so about 3 months after, yes, of course, then you can come. Breastfeeding is by no means considered, for example, a deviation. On the contrary, even more milk appears because we stimulate the body. If oncology is in the active phase, when things are very bad for the person, well, I don't recommend working because it's also unknown what the reaction will be. Physiologically, you won't do any harm, but it can cause a flare-up of the illness, and that's the worst part, because then you have to live with it.
Anatomy trains. To my shame, I'll admit that I've only heard about it very superficially, but I haven't read it. Yeah, could you maybe tell me something about it?
Listen to Kulakova. First of all, for people to understand what an anatomical pathologist is, I'll say that everyone who trains, I recommend reading it. It describes the median body factor very well, the interconnection between muscles and how they affect each other. And most importantly, it's explained quite clearly and there's a lot of terminology there. Over time, you begin to understand biomechanics based on your needs, like if you're an athlete aiming to improve performance. It won't hurt, as it highlights the importance of proper stretching from an anatomy and biomechanics perspective. Considering that this Tom Myers was not a doctor, that's the funniest part. He wasn't a doctor, but he wrote a pretty good book. I wouldn't say it's the best book for learning about your body.
So, What about professional athletes then? They might go to a manual therapist hoping to somehow improve their performance. And in which sports can this help? Absolutely. So it's not just about strength.
It's not just about strength, it's also about increasing, for example, joint mobility, returning the joints to their proper place, and reducing the risk of injury. The key is that when your body is fully functioning and everything works, you recover faster. No matter how you look at it, let's take an example. A healthy child, even if he's naughty, he doesn't calm down. But if you take a child with a disability, what happens to him? He will always feel down because he has some issues in his body. It's the same thing when it comes to sports. Well, that was a harsh example, but for many people, it's clear and easy to understand.
By the way, the subscribers also asked me to ask you about this topic. Can unhappy love or some kind of psychosomatic issue lead to something coming up that would eventually bring someone to you? Thank you.
Yes, to any doctor.
Depression and how can it affect the body? Yes?
First of all, you don't move, you don't want anything, you try to hide, that's what you feel like. There are several types of depression.
Well, man, depression. What does it look like as your illness?
He constantly withdraws and shuts himself off.
He's there.
Yeah, it's a defense mechanism.
How can you treat it if you don't treat depression?
No, not depression. First, you need to see a psychiatrist or a psychologist.
Well, you see it and you say,
I say, like many people come to me and I say, why don't you go see a psychiatrist? This is especially a factor during puberty in girls because parents don't talk to their children, especially with girls. And very often this leads to poor posture. Because when their breasts start to develop, they begin to hide. They try to hide their breasts like this.
and I used to hide because I had huge gynecomastia. Well,
It can be removed.
mine was removed late, so I used to hide and always put on a sweater first.
You see, I'm just telling you, it's a little cold.
My grandma would immediately give me a warm sweater, so even when it's 25 degrees and sunny, I'm still wearing it. I used to wear my backpack on my front in the subway and felt this way when entering the train car.
And everyone is looking at you.
They're just staring at my chest and choosing.
Which one is bigger? It's psychological. Yeah, that's exactly how psychology affects our mind and body. Because you start to hide, you start to think that everyone is looking at you because you're not like everyone else, and that's your answer. About accidents, about unhappy love, it's the same thing because many people think that everyone is in love and I'm the only one who's unhappy. And he will hide, he will squeeze you from there and listen. There were, well, some articles that were very funny, but I don't know if they're actually confirmed or not. The fact that psychosomatics sometimes led almost to fatal outcomes because, well, a person didn't want to live due to psychosomatics.
The issue of fatal outcomes. I know that you went through how many? Three clinical deaths. Tell me about all three. Clinical.
3 incidents in a year and a month. First, I spilled boiling water on myself and was in a coma with clinical death for 48 seconds. And in the hospital, I didn't have the first negative, I had the first positive, I had the first negatives, but I didn't have the first positive.
There was a condition.
There was a state of shock. I had a thrombosis during the blood transfusion and my heart stopped for 48 seconds. After 48 seconds, I'll tell you something funny. I only found out about this when I was 17. It's all because neither my mom nor anyone else knew because, well, they hid it since, well, the child died on the table. I won't name the hospital to avoid issues, but the fact remains. 48 seconds pass and the heart starts beating. Well, I was already addicted, and at 7 years old I end up in the same hospital again in the burn unit, just like in a cartoon.
You again?
That's a funny story too. I had a rare acetone accident and caught fire, burning my legs, stomach and hands. It happened while some acquaintances were handling acetone. The nearby entrance's door opens easily and I saw some acquaintances there.
But I didn't have any trouble breathing or anything like that.
They were setting everything on fire, pyromania.
I just don't know. Maybe some of those pranksters.
No, it was the 90s. What did you expect? Pyromania, usually pyromania. Yeah, something, to set something on fire, like sticks, wood. Well, teenagers, I was 7. They were maybe 11 years old, no brains, Kalika. Whether I was a friend or not, after a while I approached them, the door opens, and I cover myself so it wouldn't be seen, pretending we're just playing marbles. The guy in front of me suddenly runs and kicks the lid with his foot. Remember those 90s air freshener sprays with huge caps? The whole cap just flips over onto me. And as you know, acetone is very volatile. It evaporates quickly. Yeah, it's really volatile, so I got covered in it. Basically, I got soaked like a matchstick, so I had to put myself out because all the kids panicked and ran away. I came home, all burned, and my mom, as usual, was in shock. They called an ambulance, they checked me out, and I stood in the bathroom rinsing myself with cold water, just to somehow ease the pain, and then they took me to the hospital. So I had third-degree burns on my stomach. I was wearing shorts, and basically the shorts burned through my skin. Then they began operating on me with a simple incision. My heart stopped for a minute and 4 seconds, at least that's what the doctor told me later. My heart stopped a minute after resuscitation. It turned out to be the same doctor who treated me when I was a year and a month old, only now she was the senior doctor and she was just supervising the operation. She's standing there watching, knowing it's me and that I'm a tricky case. And then a minute later, they call the time of death, but after 4 seconds, my heart starts beating again. It's a regular clinic.
And the third time?
So the third time was recently, and well, it was really, I can't really say. Well, fortunately, my wife was nearby. Yeah.
Did anything change when you found out, or when it happened?
When I found out, nothing changed, but last time everything did, the whole world. What about your worldview? Your understanding of what you need in life. First of all, what is important to you? And the most important thing is family. Because when you just look at yourself and your wife from above, those 30 seconds that feel like an eternity, you realize what really matters in this life. That this is the most important thing for you. I assure you it's true.
After that, you reduced the number of appointments.
Right away, yes. Well, since everything was scheduled, I immediately understood that's it. I work like this, I do it this way. I no longer take anyone after a certain time because I have a family and work normal hours, 10 to 6 since February. Everything is now scheduled for me. I reserve specific days for my family, like 3 days a month and the last weekend, Friday to Sunday, just for them. I don't answer calls and forward everything to my manager, since family is my top priority.
I agree.
Yes.
Why so many tattoos?
That's funny. Let's return to the burns. But throughout my childhood, people saw me as Africa because I was covered in burns and looked like a freak. I got used to it and was fine. Fun times. But at some point when I became a teenager, I was already studying at med school, still getting my paramedic degree. So I started covering up my burns. Well, it all actually started with the burns on my hand right here and there.
It began with burns and then progressed.
Yeah, listen, I like it,
No,
I'm listening. Yeah, even if I judged, that's your worldview. So how do I bring them together now? Honestly, I can say that the only tattoo I'll always keep, the one I'll never remove, is the number 28 on my neck. First of all, it's the day of our wedding with my wife and my child's birthday. 2 key dates in my life are tied to this number. It's my most important date, and everything else I have is genuine. I want to remove them and then decide whether to get new ones or not, but I like it, It's just that right now the tattoos I have aren't the ones I want, and that's pretty important.
let's return to manual therapy. I've seen many videos of people being tapped with small hammers.
I already gave you an example in...
Your hands get shocked, like,
But the nerve damage, I already gave you an example about the girl.
so you can't do that, right?
No, absolutely not.
They really love it in Dagestan and Chechnya. Why are there so many doctors now?
Well, because it's something new, people are drawn to it, people are interested, let's put it that way. The vertebral process can be broken with enough thumb pressure. If someone exhales fully and you grab it, you could break it, potentially causing disability. Because everything gets disrupted right away. Imagine if you weren't there. Maybe I haven't been there myself, so I can't really say anything specific. Yes, because people who went to such specialists always complained. There was never a case where someone said, wow, I went there and felt amazing. No, that never happened. And I'm speaking specifically from the words of clients who have been to such sessions. Personally, I can say that I'm against this. And you won't even be able to make any claims against this person because they all provide documents stating that they are not responsible for the consequences.
And what do you think? How should people who basically use this harmful method be punished? Yes?
You hear? If they caused harm, then just like any doctor, a medical error.
Legal responsibility?
Legal responsibility. Yes, that's true. It doesn't matter which doctor. If a doctor like Saloff directly harms someone and leaves them disabled, that's what matters. Well, take responsibility for it or just don't do it.
Tell me, in terms of arthritis and osteochondrosis, what are the possible ways to fix something with the help of...
Osteochondrosis isn't a serious issue and doesn't require manual therapy. Regular physical therapy can fix it. First, normalize water-salt balance, support bone nutrition, and take any vitamin and mineral complex.
Any degree?
That's just regular dehydration. But if it's already slowly turning into arthrosis, dehydrated, compressed, squeezed, and starting to deform, then, unfortunately, that's something you really can't fix. The most you can do is strengthen it as much as possible to reduce the load.
And arthritis? Arthritis is inflammation, right?
Inflammation, listen, arthritis, first of all, inflammation should be treated first and foremost only with medication. No specialist will ever relieve inflammation with their hands if it's truly an inflammatory pathogenic process. If it's a pathology, if it's compression-related inflammation, yes, it's the same thing. The rhomboid muscle becomes inflamed under the shoulder blade, causing sharp pain that can last 10-15 years without relief. He's just told to get a massage or take a pill, but we actually release the muscle under the shoulder blade that's been there since childhood, and then the person forgets about it.
Question about this very procedure, by the way, which I did for Alexei today. I read the comments on your interview, and there was some guy writing, yeah, right, haha, what muscle, from under what shoulder blade, obviously it's the rhomboid, that's physically impossible. What's the mechanism behind this? Look,
let's do it this way. Where does it all start? All our problems start at the age of 3 to 4 years old. During this period, at this age, we become aware of our bodies, our biomechanics change. Let's put it this way. We have 3 types of biomechanics. Reflexive, which is from 0 to 3 years old, and from 4 to 7, it's semi-reflexive. When a child starts to learn gross and fine motor skills, and after that it's already fully controlled with slight reflex effects, this happens after the age of 7. So the age of 3-4 years old. When a child gets scared in a normal situation, what happens? You have kids, right? Newton.
we're waiting in the process.
The child, what does he do? He gets scared, and a reflexive protection of the cervical spine occurs. We inherited this from primates. It's a reflex. Scare a monkey, scare a child. It will be the same. Even many adults do this. This movement happens because the body can't keep up with the reflex. The rhomboid muscle goes under the shoulder blade.
And what does goes under mean?
It actually goes into spasm.
It spasms, right?
It spasms and moves under the shoulder blade in some people when you stabilize the shoulder blade and expose the rhomboid. Sometimes it shoots pain into the finger so badly because, imagine, it was under terrible tension during all that growth. Then suddenly it shoots into the finger. Sometimes it feels like the finger goes numb afterwards. So that's exactly why a person loses the function of stabilizing the thoracic region. If you look, for example, at a child's skeleton, it's straight, and an adult skeleton has an arch in the thoracic region. There should be no difference between adults and children, because when we activate the stabilizing function, our spine straightens out because it's constantly being fixed in place. It's the muscles that are supposed to distribute the load from the spine and stabilize it. Our spine is a framework. It's not a supporting function. It's not a load-bearing wall in a house. The muscles are responsible for this, specifically the strap muscles. Throw stones at me if you want, but it's true. Their atrophy leads to cervical hyperlordosis. Even though their main task is to lift the head, in fact, they also hold the entire neck on its axis. When it weakens, the neck moves forward from its weight. Strengthening it returns the neck to normal. The thoracic region stabilizes the rhomboid muscles, which, as I mentioned, help maintain upright posture and support the thoracic area so we can walk without strain. Some people strain themselves and develop habits, but they are actually harming themselves. And dysfunction of the lumbar stabilizers, the quadratus lumborum muscles, which are responsible for the lower back. If they all stop working by age 7, excluding the neck, which stops later.
Guys come to the gym and say basically, I go to the gym not to bulk up, but to be healthy and feel good. What exercises should they do to achieve that goal? If it's not about looks,
that's fitness, then it's more about isolation exercises, minimal work with your own body weight.
are body weight exercises still mainly linked to pull-up bars and free weights?
No, not parallel bars. On the contrary, remove that work. Working with free weights, working with your own body weight too. That's great. It's an increase in endurance, strengthening of the ligamentous apparatus.
Barbells, more machines, that's for
those who just want good health. When a person moves more, they already feel better. No matter how you look at it, they get their whole body going. Let's put it that way. It really starts working. Isolation exercises should be limited, not eliminated entirely. If you're working with free weights, don't grab too much or push yourself too hard. Just work comfortably for 15 reps and enjoy it.
a muscle like the diaphragm, that's also a muscle.
Yes.
You manipulated your breathing. Explain what this involves, its purpose, and how it works.
It's all done very simply. We have two types of breathing, reflexive and semi-reflexive. Reflexive is our breathing that, like Swiss cheese, is tuned to our body. I'll explain it clearly. We should breathe with it. Our lungs move proportionally to our ribs, but over time, due to stress and strain, our ribs and intercostal muscles get spasmed and they can't relax on their own. Because of this, the lungs start to take in less air, hypoxia begins, and the brain sends a signal to the diaphragm to activate increased work. People breathe using both their chest and stomach, typically about 80% chest and 20% stomach. It should be roughly like that, but for some people it's completely different, some only.
And at night?
At night as well, really, it should be the same. I'll tell you about it now. So, when the ribs are in spasm, the lungs can't fill up properly, and diaphragmatic breathing kicks in. For some people, it goes completely there, and then the lungs fill up only about 30%, while the diaphragm does 70% of the work. It's not as scary as it sounds, but there's one thing: sleep is very important. A person who breathes with their belly will never get a full, proper night's sleep.
They don't reach stage 3 sleep?
They don't fully go into it. Yes, you need to enter the brain sleep phase, the brain's rest for 3-4 hours, if we're talking about an 8-hour sleep. Basically, you went into it for 3 minutes and came back because hypoxia started, since the brain can't stop controlling diaphragmatic breathing because it's reflexive and auxiliary.
By the way, the same thing happens with iron deficiency. When you have iron deficiency, that's absolutely right.
Oxygen enrichment is impaired.
You go into hypoxia. Because of this, your breathing pattern changes. You don't go into deep sleep. You wake up in the morning feeling exhausted.
That's what they call a cast iron head.
Your adrenal glands suffer, making it hard to wake up in the morning. Many see a sleep specialist, but simply removing the hypoxia factor can solve the issue.
Hypoxia. So what do? It's very simple. I create compression on the chest, just enough for the brain to give a feedback response.
Then you quickly pull your hand away.
Yes, I say inhale and exhale with compression. The brain resists my compression because it thinks it's about to be harmed. When I tell him to take a sharp breath, I just remove my hand. Well, the person starts to take a sharp breath, I remove my pressure. Since his resistance is gone, he opens up, and that's it. This rotates the rib section's mobility, and the person begins to breathe.
In your practice, there are a lot of manipulations, movements, and techniques that, in fact, are kind of like nobody really knows how they work. This isn't in the books. I found confirmation, though I can't prove it, so people hate on me, but it works. For example,
leg alignment, yeah, it's all there. Like, yeah, he supposedly bends his legs, but no, I don't bend my legs, because if I did, people wouldn't be coming to me. They wouldn't return, the legs go back, but some still stand on one leg because they never broke the habit.
for instance, during endoscopy, I operate standing, not sitting, unlike with laparoscopy. I stand on my left leg with my right over the pedal just for a moment.
Yes, it's a work factor. Some people also do this daily, standing on one leg while talking.
Clean on one leg. For example,
I like herons. They stand and even wash dishes like herons. So what happens with us? Why do we all have different leg lengths? We shouldn't have asymmetry, long legs. Well, no, not counting bone shortening pathology. We're not talking about that now. Yeah, that's really a pathology. In a healthy person, the legs are the same length. Why? Because we constantly use one side more than the other. We press the joint into the capsule, and that's it. It stays there. It's under compression, since the stabilizers of the lumbar region aren't working yet. There's more. Well, when our iliac muscle spasms and pulls the pelvis towards itself, they lock the joint in the joint capsule.
just so you know, your haters made nasty comments about this when you mentioned it, so I'm letting you know in advance.
You start sitting on your butt, and well, I have a lot of people listen. Later, when I found out that a person first wrote nasty things about me and then came to my session and was kind of amazed and then came again, not just once. And when the joint gets pressed into the joint capsule, there's this condition, arthrosis, right, of the hip joint. In 90% of cases, actually, this happens simply. Because of this, what I do is I apply a light traction, I work on the hip joint, the joint aligns on its axis. Then secondly, the joints are in place and the leg lengths are equal. Later on, when I activate the lumbar stabilizer, I rotate the pelvis and the joint is in its place in the joint capsule. It holds it in place due to anatomical compression, and that's it. If someone doesn't always stand on one leg or sit with one leg crossed, their legs will be the same.
Why do so many people have a negative attitude about this?
What the hell,
Like, it can't be?
Probably.
Is there anything else for what?
The rhomboid muscle under the shoulder blade. Let's do it this way. Everything I work on, specifically in terms of stabilizers and joint mobility, since it's very simple, very easy, and doesn't require 30 sessions, everything is considered hate. I nitpick every move. Both colleagues and manual therapists came, others too, like, damn, after the sessions teach me.
Tell me, can manual therapy replace a surgeon, replace surgery if there are indications?
If there are indications for surgery?
And all these stories that I went, he got me back on my feet. They said I needed surgery. Most likely the surgeon was wrong.
Yes, it means the surgeon looked at the situation incorrectly. The thing with hernias...
By the way,
That's a good question. A manual therapist never removes a hernia with his hands, the hernia itself. He can relieve its compression, and in the best case, it might dissolve. There have been such cases, and I've had them too. I treated a girl with an 11 mm neck hernia by adjusting her neck. There was only one session before she left for Germany. 6 months later, she called from Germany and said, "Seryoja, you probably don't remember me, but I had the hernia." I replied, "The 11 mm hernia in the neck?" I remembered immediately and said, "Hi, what's up?" She said, "I had a medical checkup here." I said, "And?" She said, "I'm a bit shocked." I said, "What happened?" "Don't keep me in suspense, I'm curious. Did something happen? Did something get worse?" I immediately thought something negative, you never know. But then she said, "My hernia has shrunk to 6 millimeters. Simply because we realigned the vertebrae. Let's put it this way. When it comes to hernias, usually people don't feel a protrusion. In rare cases, yes, a person might start to feel radicular syndrome because of the protrusion, but that's rare. People usually start to feel a hernia when it's 6 millimeters or larger. Compression on the canal. We're discussing exceptions. Some people have narrower canals or larger spines, which deviate from the norm. Physiology. Such a person has up to 6 millimeters in an average body. A person can't feel a hernia. Why? Since there's no root involvement, the nerve canal isn't compressed, but he can still feel the hernia. Against the background of compression and dysfunction of the stabilizers, we activate the stabilizers, the vertebrae align on their axis. They get unloaded because the load shifts from them to the muscles. The hernia then starts to be in the space, but the compression doesn't go away. That's just an example about hernias. Some people just want acupuncture for them. A skilled specialist can often remove it as it dries up using many physiotherapy methods. Some people do nerve blocks for hernias, but I kind of have mixed feelings about blocks. Yes and no, I'm not really a supporter of nerve blocks because first of all, you need to know how to do it, and most of our specialists don't know how. It's the same with epidurals, unfortunately. I've had so many women come to me after childbirth who were injured during the epidural.
I had surgery on my leg and refused any injections in my back. I told them to do anything else, but not that. Why? Well, because I have an acquaintance who had an epidural. I don't even remember what procedure it was, but it wasn't anesthesia. He was being treated for rectal cancer, I believe, and undergoing a procedure.
I don't remember if it was a patholonoscopia or something, but that's not so important.
An abscess left him paralyzed and disabled. Years later, he can barely walk, and his bladder and intestines don't work properly.
Nerve damage. All I can say about nerve blocks is that they're your own risk. Personally, I'm against them. If they offer, I say it's better to cut me open while I'm awake or just do nothing.
Especially when you see the size of the needle they use for spinal injections.
A needle like that, most of our specialists don't even use ultrasound guidance. Well, at least, damn, do an ultrasound, see where you're injecting. They just took it. I've seen it so many times. Yeah, they just do it without any equipment. Bam, injected, and you think, damn, what a master, man. I feel like I'd need 5 lifetimes to get to that level, to reach that.
Tell me, chronic pain and manual therapy, when can it help? In what cases or for what reasons can it be useful?
Let's look at chronic pain as a factor of what exactly? First of all, we have phantom pain, sometimes.
Sometimes it's a defense mechanism. Yes, in other words, your body actually prevents you from doing something because.
There is a problem there which.
So you don't always need to.
Relieve the pain. Yes, well, for example, I've had leg pain all my life for 17 years, and there are days when I just want to jump out the window. I feel better now, thanks to working on my mindset and my family's support. It barely hurts anymore. Compared to before, when your wife had to help you out of bed because your leg hurt so much you couldn't even stand, even though you're a big, strong guy. Every added nerve makes the entire bone ache. From the lower back down the leg, through the toes and foot, every millimeter, you feel this intense tearing pain as if the bone might burst. I go through all this without painkillers, knowing if I start, I'll get hooked and make things worse for myself. I've gotten used to it. My pain threshold is so high that I don't even notice things like a stiff neck. So chronic pain doesn't always mean what you think. Yeah, I agree. Sometimes chronic pain can be in your head, like phantom pains. Self-suggestion is a very common thing. Nowadays, people have become very susceptible to information because many don't read what they should or don't read at all and don't develop themselves. Unfortunately.
So we come to you, you do something, and I feel better. For example, yes, why is that? What is it? Tell me, what should a person do after a manual therapy session? They say you shouldn't do sports.
I tell everyone based on my own research, I'm talking specifically about my own research now.
I get that not everything has evidence. It's the same in my practice. Some things I just. You do all this. Yes, I accidentally found a solution to a problem that others couldn't solve. And when I solve it, they say like, well, that's not in the books. Yeah, it's not there.
Yeah, no, well, first of all, let's put it this way. All of my methods aren't in the books. Not yet. But everything has its time. For example, homework, I tell everyone, really everyone, it's all based on a tennis ball.
Specifically a tennis ball?
A tennis ball. Here's why. There are MFR balls.
They are hard.
Hard, and the fact that they're hard is our problem. The foot, it's quite picky. When a person starts, well, we have a foot, right? And we have the outer arch of the foot. So the heel and the outer arch of the foot. We place a tennis ball and apply compression to it. This way, we completely relieve all the pressure with our full weight using light compression just up to mild discomfort.
I always say, for example, when you brush your teeth, you can stand like this.
You brush your teeth and stand like this.
But for how long? For how much time?
30 seconds is enough. For me. Everyone who stands like this after a week already feels how much their feet have relaxed. And just so you know, that's how I got rid of all my flat feet. Not completely, but at least to the first degree, I can easily wear sneakers. My shin stopped cramping because that's also a huge factor in the load and everything else.
What else?
Lying on a roller, that's what I already mentioned at the beginning. And applicators are a matter of personal preference. I've never been against applicators. It's stimulation and improvement of the neuromuscular connection. That's a fact. You can stand on them, you can stand on nails. That's also a great practice. First, it's about knowing your body and connecting your mind and body.
And pistols.
Percussion massage, you need to know how to use it. It's a great thing, but never use it on lymph nodes or on the face.
That means the groin behind the knees?
Groin, behind the knees, and the chest area near, but not directly in the armpits from the chest side only.
We're concerned about thrombosis, but there are no large vessels nearby.
First of all, inflammation of the lymphatic drainage.
We're worried about lymphangitis.
Yes, absolutely right. As I always tell everyone, work precisely. Regarding chronic cases, there is such a condition as an old injury, the levator scapulae muscle, fibrosis, the levator muscles. I just explained this to you, now I'll explain it to everyone. If you often feel a pull from your neck to under your shoulder blade and across your trapezius to your shoulder in a T shape, and one arm gets tired faster at the gym, even during workouts, it's not about strength, but rather it feels like your arm is starting to go numb. Congratulations, you have fibrosis, not inflammation of the levator scapulae muscle. This small muscle sits in a capsule between the trapezius and scapula. When you were young, you heard it and ignored it, since as a kid you didn't really know your body. And it formed connective tissue so that the muscle could heal. And only with a percussion gun can you get rid of it. Just hit that spot for a minute and that's it. Someday I'll show it, I'll make this video so that people just know what to do about this, about homework, about percussion guns. Work each muscle for 30 seconds up to 60 seconds max. You found it, ran it along your leg, arm, and bicep. Notice the strongest sensation here. 30 seconds worked through it, and your bicep relaxed. Basically, as a factor in working with a trigger point.
And these MFR rollers?
MFR rollers are basically like stretching. You need to do it, but you also need to understand it. It's not as simple as just rolling around. I once rolled and hurt my lower back, displaced my third lumbar vertebra. When that happens, it can pinch the nerve canal, making it impossible to stand or sit. It's constant hellish pain, and it doesn't go away right away. Because you have an inflammatory process, you need to first reduce the inflammation with medication, and then physically, you have to choose and put the vertebra back in place.
There are various sports, like billiards or throwing events. Shot put, yes, probably, or hammer throw. So, which sport most often brings people to you? And in which sport can you help a person the most? What about specific loads causes it? I often don't know. Maybe horseback riding. Yes, everything is equally harmful.
Well,
there are still certain types of sports. For example,
look, shot put, yes, if you do it incorrectly, it will increase the rate of destruction of your shoulder, your joint. Shoulder girdle arthrosis can also result from this type of compressive jerking movement. If your chest also spasms, it's compressed, causing the joint to rub against the capsule and speeding up arthrosis. Weightlifting too, especially if your chest is in spasm. That's why I always say, guys, stretch. Make sure to set aside at least 1 day a week for it. No matter your sport, stretching is essential.
Manual therapy improves stretching.
Yes, but we're actually putting the joint back in its place, no matter how you look at it. We're unlocking the joint, and because of that, we're restoring mobility.
How do you know if you need a stretching coach or if online resources are enough? Great question. SU4.
Look online for a trained specialist. Someone who has studied this is always better than a YouTube expert. Do you know why? Because he can show you the angles himself. You can watch a video and do the stretching, but there's no guarantee you're doing it right. You never see yourself from the outside. It's the same as in the beginning. I always said, if you go to the gym, get a trainer. But there's no guarantee you'll get a good one, given how our trainers are.
He may not do it perfectly, but he'll teach you well.
He'll see you from outside. Stretching, yoga, all these factors that improve our lifestyle. Specifically when it comes to sports, the most common people who come to me are athletes, bodybuilding, powerlifting, mainly from these areas. Well, runners come here too, and tennis players, by the way. A lot of tennis players come. It's just like Ironmen, those kinds of athletes. CrossFitters come too. Swimmers come all the time because when you put their shoulders back in place, they start swimming better. Well, that's because of the increased mobility in the shoulder joint.
And wrestlers, yes.
Wrestlers too.
But what do wrestlers wrestle with?
Kyphosis, thoracic spasm, and severe dysfunction of the lumbar stabilizer.
And how does it manifest in them?
They start moving worse, they start moving using their antagonists, finally.
They become more stiff.
As a result, their mobility worsens and everyone's strength declines. Because when a muscle is severely spasmed, it gets less load and can't handle as much weight. And here, if you put a wrestler or a boxer in the same position, their shoulder girdle movements immediately become faster, and this is beneficial for everyone. Chess players also suffer because they are constantly sitting.
Tell me, do you know of any interesting studies that are currently being conducted which might help develop new ones?
Most of ours were conducted mainly in the early 2012-2017 years. The best, pretty decent Holomes.
For example, something interesting.
Holome is likely a surname according to F.V. He described manual therapy as a factor of assistance and a factor of movements applied to the body by a specialist. But also, yes, when I was reading, I understood that there is this, old school factor like it's written in the textbook. That's about how this factor was described. But he's very knowledgeable and explains everything clearly. There, the most common, the newest ones, yes, are Europe, and America. They study this very thoroughly because they implement it in every sport. Yes, they had chiropractic care long before we did. Manual therapy, bone setting, hours. It goes back to ancient times. There was always a bone setter in the village who helped everyone. He really helped, well, before he was called a healer and so on, but in fact it's the same bone setter.
Subscribers are asking. I asked for questions in Telegram, and they say opinions differ a lot about pull-up bars. Is it useful to hang on a pull-up bar? Well, probably, classically, let's take the upper leg for example.
No, hanging upside down right away. First of all, about hanging upside down. You don't know what's going on with your blood vessels. You don't know what your cholesterol is. What if your whole body is full of cholesterol plaques? What if
an aneurysm has formed in your head?
Yes, you turn over, you have a stroke, that's it, and they'll take you out of there, but it won't be you anymore. Just hanging on the pull-up bar is amazing, just to do it, just to hang, exhale completely, and just let your body, just let everything fall into place to create traction. I hung from the pull-up bar, exhaled, stretched my heel down, and felt my vertebrae align. It's an amazing feeling. You can even ask someone if you're strong enough to pull you down a little bit from below. I asked my wife, she hangs on me like this, like Alk, and all my vertebrae go like that, and that's traction. And in fact, you can't really hurt yourself here unless you do it abruptly. Everything should be gentle and careful, guys.
But these twists to the left and right with your spine?
If you have, like me, 70% destroyed, I can't avoid this because I cramp up and my legs lock. For most people, it's the same. If you have it, it's like your arms. It could be psychological, it could be a habit, it could be a deviation from the norm, a micro displacement of the vertebral processes. Yeah, well, a significant deviation from the norm. Let's put it this way. If you crack, you won't be able not to crack. Just do it carefully. Again, I'll repeat, all cracking in the body should be done carefully. And some people I see are trying to pull their fingers out. I'm like, why do you do that? Just take everything gently, stretch it out, create some compression. There you go, that's it. You don't yank your finger. You don't try to injure the joint capsule. You just do it smoothly, and you see everything. It doesn't crack for me because everything is tight.
Here's an interesting question, something like, and I quote, helped but shouldn't have. Is it possible that I could go to a manual therapist, he helps me and I feel better, but in fact it just postpones the inevitable and could actually make the results of, say, some surgery even worse because you did it later? That's an interesting question.
All right, here's how I see it. Well, I'm just a supporter of the idea that surgery should be the last resort, as long as it's not harming or creating a risk factor for your health. Let's put it this way.
If, for example, you fixed it for him and a year later he needed surgery, the hernia could become twice as big instead of staying small.
What's the difference? Not just about the hernia?
Well, not a hernia, any diagnosis really. Is it possible that you helped someone, they actually felt better, but in fact because of you, he ended up needing surgery anyway, and because he came later, he came in with a more advanced stage?
You'll never know if it was your fault. If someone wants surgery, they get it. I always say, well, look, it's your decision. You can always have the surgery later if things get worse. Well, it depends on the situation, but still.
We can't put it off, like with a tooth, you know?
Wait, if it's bothering you?
I'll give you an example. A patient comes to me with a prostate adenoma, and he's taking medication that improves urination. We set a threshold for when endoscopic surgery is needed and when it's already required.
It's clear.
Laparoscopic. And I say, where were you before? Why? He says, well, it's been bothering me for about 10 years and 5 years ago I wanted to have surgery. I ask, so why didn't you do it? I came to the doctor at the clinic.
Well, he said, you don't need to do it.
He said, you don't need to, just take this medication. He gave him a medication that only relieves the symptoms.
But it doesn't solve the problem.
And he came to me already with an adenoma, twice as big, when even with the medication he couldn't urinate anymore. And because of that. So yes, maybe he had the surgery later, but he didn't get any younger, and in 5 years the gland got bigger. I mean, if he hadn't gone to the doctor, who at that time actually helped him.
You see the perspective of similar doctors. A manual therapist or osteopath doesn't do surgery. That's a surgeon's job. People often think they'll try a manual therapist first to see if it helps. Let's suppose
everything seemed to help. He slept at night thanks to the pills and felt better, but they only masked the symptoms.
You see, this is exactly what comes from a specialist, which is what I'm getting at. If the specialist is good, he will work with the problem, not just the symptom. He will eliminate it if that's possible.
He saw someone who treated the symptoms but not the real issue.
No, that's the problem there.
It could be like that.
Sure, it's the same thing, and the knee. Well, I don't work with knees at all. Let me explain. You just can't work with them. Adjusting the ilium realigns the knee because of anatomy, load position, and the shift from joint to muscle movement. Well, before, you used to move through your joints. Your knee was in one position, roughly speaking, and that's how it was. The load was created with every movement, but when we take that load off and shift it to the muscles, the knee goes back to its proper place. For some people, when you adjust the ilium, the knee just clicks back into place and there's immediate relief, not in the literal sense, but the joint relaxes, the load is gone from it. We see this as more of an exception. Well, the knee, it's just that if you have, a meniscus issue, go to a surgeon. If you have torn cruciate ligaments, go to a surgeon. If you have shoulder arthrosis, well, a manual therapist at best. He won't restore your shoulder. I always say I can't restore your joint. It's physically impossible.
A question from Alexander Ponomaryov on Telegram. I visited a manual therapist 2 or 3 times, and each time the result was pleasing, but the tension in my neck and the back of my head keeps coming back. One reason is the manual therapist does not correct the atlas, the first vertebra. How can it be corrected? And which methods are safest and most effective? What do you think?
Let's put it this way. First of all, displacement of the atlas is a birth injury. Or, you hit your head against something. This vertebra is almost connected to our skull, and if the atlas is displaced, that's a birth injury. However, the tension you feel at the back of your head isn't from the atlas. It's likely a second cervical vertebra displacement and reduced blood flow. First, it's about picking a comfortable pillow, since sleep quality matters. For example, that's good. Dear friend, if you're watching right now, the answer to your question is very important. By the way, this applies to many people. If you went to a specialist and started feeling better, stopped feeling tension and pain in your neck, but after a week, all of this slowly started coming back. It's not because the specialist did a bad job in the first place, but because your lifestyle isn't suitable for a healthy body. It's improper sleep, the wrong pillow. I'm about to say something that I hope will be a revelation for many of you, and you'll really start helping yourselves. How do you choose the right pillow? You know, the basic angle of the shoulder, the length of the neck. It's not just about the feeling when you pick a pillow, you lie down with your head on the pillow. Choose a pillow based on your sleep position. Side sleepers should use a pillow for side sleeping, not one for back sleepers. It feels comfortable, but I won't sleep that way. This is just one criterion, the feel of your neck on the pillow. You lie down, your head and neck resting on it. The only thing you shouldn't feel is your neck. It should disappear in terms of sensation. And if your neck is completely relaxed on the pillow, then this pillow really suits you perfectly.
My little toe goes numb, and I have lower back pain when sitting for a long time. I'm 42 years old.
This function of the lumbar stabilizer may compress the sciatic nerve.
He's asking if a lumbar protrusion could cause this back pain.
If the protrusion is more than 6 millimeters, yes.
What should he do?
Well, look, it's like this. First of all, you can just try to release your iliac muscles yourself. It only takes about 10 seconds. If you really want to get rid of your lower back problem, as you feel it, release your iliac muscle. It's very easy to do this through compression. Just find the pelvic bone with your thumb and slide your finger underneath it. Create compression, pull your leg toward you, not at the level of the bone, not above the bone, but exactly below the bone, down, a little toward the groin. Apply compression to it, bring your leg toward you, hold for just 10 seconds, and then, without changing the compression, simply straighten your leg. The layer will change instantly as the lumbar stabilizer activates.
This is a very unusual question. Can the use of manual therapy for an intervertebral hernia lead to a spinal cord rupture and as a result paralysis? Yes.
Yes, it can, if the work is rough, and there have been such cases.
This one will be right on the table.
It will be right on the table. The person will be paralyzed immediately. There was a case like this 2 years ago, I think, in St. Petersburg, where a manual therapist adjusted a child's neck and twisted it, breaking it.
What are the most common myths or misunderstandings associated with your profession, and how do you deal with them?
First, let's discuss the myths about my profession or work.
Well, work is fine.
Myths. People don't believe that, well, basically you help right away. Like a person comes in, you fix them, and they leave. People wonder, what's the catch? Why is it so cheap? Yeah, these are the myths, like the idea that health has to be expensive. That's the main myth. It should be affordable. It's clear that, yes, over time I'll also raise the price because I won't be working as much as I do now. Well, I have development going on in terms of work, business, opening new branches, and I'll also be sending people there, my specialists, my students, who will help just like I do. I have some guys, they work just as well. They're also excellent, real top specialists. But the main thing is this stereotype. They don't want it. Right now, they want to come to you. Yeah, it's some kind of.
He's just as good there?
No, I really want to come to you. I always say go to him first, and if it doesn't work, I'll fix you up for free. But no one has needed a free fix after seeing him. And this is the thing, this moment, damn, that's also the most frustrating part. Are you not going to break me? What if you make a deal like that now? Exactly, that's the point. It hurts every time, I'm very gentle, I work with everyone like they're kids. In my mind, it's like I'm working with my own daughter. That's why I would never hurt anyone.
I'm the same. When a patient visits, I genuinely want to help and treat them that way. Well, if it were my friend or someone I know, I would try my best to help them, right? He says, yes, but I thought you would prescribe me some testers. I ask, why? Well, they say on the internet that you prescribe them to everyone, but in my case, let's say only 1 out of 100 gets them.
Stereotypical thinking is just hate. You know that yourself, but that's a different matter. People will always write things.
I've stopped worrying about it, like,
Those tough guy quotes like, if no one talks about you, it means you haven't achieved anything.
they say there's this Dr. Brand, and people go to him like, that's Perry, you don't need that, it's overpriced. Many people, for example, visit you just to say they went to you.
That's also a thing, like, let's take a picture together. Why? Where did that come from? Why me? I'm just a doctor, I'm a physician, I'm not anyone special. I just wanted to help you, like when you're walking down the street and kids are so friendly with me, and what did I do for that? I just help people. I'm just like you, I'm the same kind of person. Celebrities come to me too, but they're just people too, same bones, same soul, and so on. I always say that everyone is equal.
There's a guy watching us. He lives in Syktyvkar and is looking for something in his city. How can he really understand if this osteopath is good based on reviews or some videos? He just won't get it unless he actually goes and the osteopath treats him.
You already answered that question yourself.
Reading is pointless?
No, for some reason you can read it. You can read it, the reviews too. You know yourself, Vasya, write a review. Petya will write it. The cars write it.
Listen, look, there's a website about doctors, for example. I hope I'll only have 5s there. I don't have a single review, not even a 4, for all the time I've worked. I'm sure there are some, though. People usually write reviews either when someone helped them really well or when someone really harmed them, but apparently I haven't really harmed anyone. That's why no one is there, but you can't write a review without a document.
But here...
For example, many manual therapists don't give any documents, so it's impossible to leave a review.
But I don't give them either, since I'm just practicing. Yes, I have my own department, Nad.
Some websites let anyone post anything, even sell reviews, but that's not always true.
If, for example, Davai can't leave a review, you can always check if he exists on that site or not, but in reality, nothing will make you check that person on that site. If I'm not there, it's because of them. I don't actually practice medicine as a neurologist, well, because I haven't worked.
Where can you learn what kind of doctor a neurologist is?
If we're talking about a manual therapist, not all neurologists are manual therapists. Let's start with that, not everything at once.
There's a common question in medical education. Can a manual therapist be effective without being a neurologist or having a medical degree? How important is having one?
You need to have it, you really do. By law, you don't have the right to work without it.
There are people who work and even use a hammer, but maybe he really does help someone.
I'm not sure. They have a medical degree, but it's certified by the healthcare authorities.
Is having a piece of paper really necessary, or do you just think it's needed?
No, well, like, if you're going into...
Human...
body...
Look here. You say I do some things. I don't understand why, but they work.
No, I get this. They're just not described. I understand everything I do because I've studied it in practice. There are things.
You get how work functions, but not why, right?
Like how I walk. But that's the excuse for this. There should be a medical education. First, the law says you can't work with the cervical region if you don't actually have a neck.
Hence,
You can use anything for legs. A massage therapist can do manual therapy except on the neck, which is true.
you can't even massage the neck.
But working with the cervical area, just the neck, is not allowed. Massage and adjustment are different. Legally, we're discussing adjustment, specifically that only the cervical area can be adjusted this way. Look, listen, I have a ton of friends who are great, with golden hands, but they don't have a higher medical education. Some have it, some don't. I know he took a course and is very skilled. I can't train him with you just because he lacks a degree. He really doesn't. When will I be doing certain procedures in healthcare? Before. In order to officially make anatomical programming a real, complete, and validated method, because that's what I'm working on right now. I want to make it so that the criterion of higher education is not so important. When working with the cervical region in training, the angle of head rotation is examined, and the cervical vertebrae naturally align themselves. Actually, you're not adjusting anything, you just tilt your head at a certain angle.
Subscriber question about scoliosis. What degree do you treat?
Yes, completely. First, kyphosis can be fully corrected. Second-degree kyphosis can be corrected over time, but not in one session. You need to come every 3 months and do your homework. Kyphosis goes away. As for scoliosis, if it's first degree without rib deformation, as I mentioned today with our friend, that can also be handled. But if it's second degree with bone and rib deformation, that's a different story. Sorry, that can't be fully corrected anymore because the bones are deformed and there won't be proper fixation due to the deviation from the normal physiological condition of the bones. But the spine really can be corrected. It also depends on the person's physiology and psychology, whether they actually want it or not. This is that moment when you come in. I've already checked about the same thing. As for eating, I did, roughly speaking, some small experiments. I told some people to eat later, some to eat earlier. I understood. Within an hour and a half, our brain starts to activate muscle memory and returns back. Regarding the body's adaptation when you really want it, if you come in thinking, like everything sucks and I don't want to fix it, then you won't fully succeed because your body won't allow proper adaptation. It will change.
It's like coming in with an attitude of, go ahead, try it.
I'm not calling you a doubting Thomas. That's not the point.
Like, the episode didn't help me calm down, so nothing will help me.
Yeah, that's when you've already taken your own life. If you've done that, it's really hard. And it turns out that when FOMA comes, the non-believer, well, never mind FOMA. It's okay. He starts to understand everything at first, when your feelings really start to change. There are people with very poor neuromuscular connection, people who just don't feel their bodies at all. You try to. So, a couple came in, a girl and a guy. The girl is sitting there, and you're working on the guy's chest. He suddenly pulls one shoulder all the way back, making a full hinge movement with his right shoulder, like this, and that's about 40% of the movement. He says to you, I don't feel anything. Meanwhile, his wife is filming on camera, showing him, and he's like, wow, how is that possible? But he feels like both sides are moving the same, even though the movement is actually happening with his left arm.
They say it's self-suggestion?
They start talking about the placebo effect, but no, you see, the placebo effect is there, self-suggestion is a factor. When this has been suggested to you, when nothing has changed visually, but when they show you in front of a mirror that you're standing straight and your shoulders are actually even, but you're over there. A girl came in, always sleeping on her right shoulder and carrying her bag on it. Her subclavian area was so tight that her shoulder had already started to eat into her collarbone. I was like, wow, she's standing straight. She says, I am. Well, some actually work, yeah.
Semyon is asking you, why do people say you can get hooked on this method? Well, like, at first they helped you, and then you'll have to turn to it more and more often. I mean, at first they came to you once every 6 months.
No, I never take more or do it more often. If I see that everything is fine there, I say once every 6 months, not more often.
It wasn't like he was completely crooked and you fixed him. You helped a bit, straightened him out, and he said it lasted 6 months.
Clients call my work that, but it really isn't. It's like heroin. You get hooked on living straight because you realize you've lived crooked for years. Something always hurts, something new, but now nothing hurts.
You won't get what you needed. First after 6 months, then 3, then a month. No.
Well, that already depends on the person. I work, and I have someone who comes after 3, well, he came, and I tell him, like, a month, after 3, after 4, I look, well, come around. So there, for example, someone came to me just now and I tell him, well, come in January next time. We'll see how everything has adapted. If the person is coming for a follow-up and I understand that their adaptation has normalized, I checked his body. Everything looks fine. His legs are straight, pelvis slightly off, support a bit tight, but still normal. I tell people to come back in 6 months since I only schedule appointments that often. I don't see a reason for more frequent visits, though some ask to come monthly. But you say, come on, what's the point?
Pavel Shatalov questions Uncle Seryoja. The patient is lying down and the pelvis is fixed, and they're pulling his head until it cracks, stretching out the whole spine.
And the pelvis is fixed?
They pull the head until it cracks.
Let me explain the stiffness.
I've seen nearly the entire table move.
Yeah, that's not right, because look, we have vertebrae, right? There's an intervertebral disc, and when it's compressed, there's decompression of the vertebrae with even the slightest movement. Well, the way I did it, they go back into place, but now imagine what happens when someone does it to you roughly.
Pinching, it can happen.
Absolutely right. The vertebrae create a shockwave between each other and cause compression on the intervertebral disc. Secondly, a nerve root can get pinched, and at first the person feels fine, but after a week inflammation starts and it leads to problems and negative consequences.
Sergei Kaltano asks why most manual therapists rely on touch during the first appointment instead of looking at or referring for an magnetic resonance imaging.
No, look, tactile sensations, I don't rely on them. I don't just use touch. No, I do touch. When I need to check the mobility of the thoracic spine, I always ask, what hurts?
You work gently.
I can't cause physical harm because I work within anatomy. During a consultation, I ask, what kind of pain do you have? What bothers you? When a person says they have back pain, I tell them to go get a magnetic resonance imaging of that area, especially if the pain radiates somewhere. Most often, it's a slight displacement. It happens. You check, keep working, and understand vertebrae positions. If it's a large hernia, you can feel it by palpation. I was like, boom. I had a case where a guy came in, told me he had a hernia. He lay down on the couch. I didn't do anything. He just lay down and pinched his own hernia. His hernia was 13 millimeters and inflamed. I asked, why didn't you tell me? Of course, I immediately gave him an anti-inflammatory, and he lay on the couch for 2-3 hours. Good thing I had a second one. I told him, man, I didn't even touch him with a finger. But things like that happen too, because people don't always explain everything.
Please tell me about the worst case you've had in terms of consequences, or something that happened like that.
I just told you about it.
Maybe not with you, but in general, basically.
The world patient.
Tell us about this situation.
Well, I already told this story, yeah. I don't remember in which one, I think. In St. Petersburg a few years ago, a chiropractor broke a boy's neck.
Explain this case in detail, since the boy appeared strong and healthy.
He should have been. No, he was about 10 years old, a boy, not a guy. Exactly a boy, not a man, not a teenager, but exactly a boy. Basically, he started moving his neck and broke it. Listen, I think it was just the third cervical vertebra. For me, it's just a horror, that's all. The child suffered permanent disability due to nerve canal damage and rupture. It's fortunate he survived, but he is disabled. There are also stories about certain osteopaths, who run around with a tambourine dancing, and this is actually used in practice.
Now someone in the comments will write, "It helped me listen."
I'm really glad. I'm honestly happy for those people whom it helped. I view it through realism, medicine, physiology, and the body itself, similar to a tambourine. Well, come on, occultism is still present, no matter how you look at it.
I often ask and explain things from a medical or scientific point of view, for example, about something, and I ask my followers, I say, why don't you tell me what methods do you know? I'm interested to read what people write there.
Oh!
That's always there.
Listen, everyone thinks they're the smartest, unfortunately. Seriously, whenever you ask something or just say something, there will always be someone who thinks they're smarter than you.
By the way, let's ask them, guys, if you've ever been to a manual therapist, a bone setter, or, for example, an osteopath, write about your experience.
Yeah, that's interesting.
What you came in with and...
What
what it gave you, since I even asked questions. Many people aren't sure if this is real or a scam.
Yes, exactly.
Yes, but you have to understand, we've talked before, this isn't the first time I've seen you, and I might be biased towards you, and people don't know that. But if thousands of people write comments there, then basically by reading them, you can really understand and it will help. It doesn't help with work, it doesn't work, yeah. So in the comments under this video, there's an analysis of the statistics. Yeah, guys, please share. It's definitely interesting. We'll read it, it's important. And maybe some interesting, funny, or tragic ones.
Funny ones? Let's have more funny ones. Let's hope it's always fun. At least there's something to laugh about. Let's skip the tragic ones. Because
That's a good story since you told it, but was there any...
one that really amazed me, like a super good one, I can't explain how I did it, but I managed to do it. And she had already come to me twice. A woman about my age, I think she was 32, had the same problem as me, but for her it was on both legs and her sacrum too.
Yes.
No, her legs can't stabilize. The doctors don't know why, they just say she had a severe case of tonsillitis, incomplete stabilization in the legs. She used to walk with those Nordic walking sticks, barely managed to move with a cane. Then she came to me, I got her standing, and she said, "I'm standing differently on my legs." I said, "Great, now walk as much as you can, go eat, and keep walking, walking, walking. Give your brain the information that you're walking." She started standing on her heels, on her whole foot. Of course, her movement was impaired because she hadn't been using it. Listen, she's still the same. It's been about 10 years and she even had 2 children with this diagnosis. And 3 days later, she calls me and says, "Seryoja, I'm walking." And I'm like, "Who is this?" I didn't write everything down, so I ask, "Who is this?" She replies, "Remember the girl who couldn't walk well and came to you? That's me." I'm surprised. "What do you mean you're walking?" Well, I honestly didn't expect her to react like that, but that's not the end of it. I said, "That's great. Keep walking. Good job. That's wonderful. Excellent reaction." 2 days later, Seryoja calls and says, "I'm doing really badly." I ask, "What did you do?" She used muscle stimulators on her legs and is now back to square one. I told her to come see me after breakfast. I did the same thing for her again, and she started walking again. And to this day, she's still walking, and she says that, well, she has kids. I was doing laundry, I took the clothes out of the washing machine, grabbed a basin, stood up, and just started walking, and I didn't even realize it. I just started walking, that's all. And at some point, she takes a step and realizes that she's walking with her own legs, without that dysfunction. So, just so you understand how I live. Yeah, like me and her. Picture your leg going totally numb. You can move it, but when you stand, it collapses. Welcome to my life. That's how I've lived for 17 years, and thanks to my core muscles, the more muscle I have, the easier it is for me to live. Exoskeleton.
This is my numb leg, it feels foreign.
Well, let's call it alien leg syndrome.
It's like when you sleep on your arm at night, you wake up and it's kind of like...
And you move it, but yeah, that's how I live with my left leg, thanks to my core muscles. She studied, she had the same thing, she said I can walk, and when she came to visit me later, she walked normally on her own legs. And that was probably one of those moments that I hope in the future I'll be able to help more people with such problems. It really motivated me.
Tanyusha, this is likely the last subscriber question, yes? Braces and manual therapy, I heard that they should be combined. Should you go before getting braces or during the process? And in general, why? Explain all of this, please.
Well, you understand I'm not a dentist, but when braces are put on, there is a change in 62 pairs of jaw muscles. They really start working differently, and each time they will work differently specifically because of the braces being put on. Because expanding the jaw and positioning the teeth all affect our muscles, especially the jaw joint factor, and that's why the neck can get thrown off like this. That's why we start by looking at the muscle factor first. Whether the jaw is in place or tense, ideally, but also a good specialist who works with jaws. Well, there are very few people who will actually do it right. He just presses here and there, you feel a bit better, and he says, "See, I fixed your jaw."
But actually, you just left my jaw the way it was.
Just with a simple move. Some people stick their finger deep in your mouth saying, "I just put it on your chest, set your jaw through your muscles and biomechanics." When you go to get dental work done, a good clinic will always send you to a specialist. Not due to barter, but because it's needed for better adaptation before, during, and after braces. It's best to go at least every 6 months, depending on complexity. I understand, well, I get it. It's exactly the factor of changes in the jaw, because everything in our body is interconnected. They can't do just one thing there without it affecting something else. Our jaw is connected all the way down to our buttocks, so if there's a problem with the jaw, there will always be a problem with your backside too. Well, I hope I answered your question. Yes, it's best to visit before and definitely after as well. Thank you.
There are a lot of funny videos on the internet now showing dogs and cats getting adjusted, and they react in such a funny way, like they're all scared.
It's really touching. Listen, yeah, it works. I mean, I watched this guy too. He really does it all very well. I read about him. He's actually a veterinarian and he switched to animal chiropractic and he really does adjustments. Because I look at the angles and everything looks good. First of all, it's something new and I've seen a lot of animals. No one had ever shown such real emotion before. Then they start crying because they have a problem, no language, and can't say anything. They endure this pain despite animals having a much higher pain threshold than humans.
What would you like? Do you have some goal in your practice? Is there something you're aiming for? Do you think you've reached the peak of your manual skills? Or is there something you're still lacking?
Or is it not about the skills themselves?
So, when you're treating a certain situation, do you think you've reached your absolute maximum?
I don't know the answer. Only time will tell. Well, honestly,
Sometimes you want to decide or help, but you can't.
when someone with a disability such as cerebral palsy arrives,
Does manual therapy help with cerebral palsy? What does it do?
they brought me a 16-year-old boy with severe cerebral palsy in a terrible state. Honestly, I didn't do anything myself. I just showed his mother what she should do for him. I didn't take any money from them, nothing, because, well, the mother was alone. A 16-year-old boy completely twisted by the disease because, well, the illness takes its toll. He couldn't speak. It was really scary. My heart broke every time I saw it. When they bring people like that, I never take money from them because these people are already suffering and struggling enough. I show parents how to make their children's lives easier. I adjusted, slightly separated the shoulder blade. It sounded a bit harsh to him, of course, but I broke up the adhesions, yes, between the shoulder blades and the ribs. I relieved the pressure from his thoracic and lumbar regions and just showed how to do it. Her child couldn't even lie on his back for a minute before, but with his mom, we lay there for 10 minutes and talked mom. His mom was just shocked that her child was lying on his back. He's not lying on his back normally, his body is twisted, but at least he's not screaming, she says. He couldn't lie or sleep on his back for more than a minute, so he always slept in the stroller.
And look, there are patients who are so-called spinal patients. He can't feel or move anything, for example.
Oh, you mean totally paralyzed?
Completely paralyzed? So, do you need to do anything with the part of your body that basically doesn't move and you can't feel at all? Listen.
Well, wheelchair users come to me. I always take off their cushion, always, and I never look. I can't do traction on a leg that isn't there, like if someone comes to me without a leg. Many wheelchair users see me, and after my sessions, life gets much easier for them. They start sitting on their buttocks instead of their tailbone. Imagine not being able to sit properly, always sliding down, and constantly having pressure on your tailbone. It's one thing if a person can't feel, let's say, the 12th thoracic vertebra, but if he can feel it, it's even tougher for him. He can't even sit properly in a wheelchair. If there's an opportunity, it will never be unnecessary. Let's put it that way.
This is probably the final question, but the answer should be as honest as possible. If you had the opportunity to go back in time and make a choice right now, you wouldn't have any health problems, your lower back wouldn't hurt, your leg wouldn't hurt your whole life, you would be a completely healthy person, but your life would go down a different path. No.
No, mainly because I would never have met my wife through the media.
And if you don't take my wife into account considering the number of people you help, would you be ready to choose an ordinary life, a different profession?
Or never.
So, it turns out that in this case, the price is already a conscious one. This is my price.
Conscious, I understand all of this. I'm not complaining, I'm living. My arms and legs work, and if they didn't, that would be another story. As long as they move, everything's fine. Yes, it's hard. sometimes extremely hard and unbearable. When you're in a bad mood, everything hurts and you're exhausted. That's what family is for. They always support you, and honestly, sometimes it's really hard and you want to give up. You're like, damn, yeah, why? And then you realize why. Because if not you, then who? And I really want to help everyone. I have a dream, a really big one, I call it a Napoleonic plan, but there will be a day when I make it happen. I want there to be at least one specialist in my method in every city all over the world so they can help people. And not my own clinics, not about me being some kind of tycoon or anything like that. Happiness isn't about money, it's about having a specialist in every city, and he will help everyone he can. That's my dream. For people to forget what musculoskeletal problems are, for people to no longer suffer with their lower backs and thoracic spine. So, people, friends, let me tell you right away, take care of your health, take care of yourselves. You are your own first priority, and if you love and value yourself, others will love and value you too.
Thank you for coming today and finding the time. I really appreciate it.
Everything's for the best, everything's for the good. I hope I helped and clarified things. I hope there will be questions. Ask them in the comments. I'll try to check in and answer if I have time. I'll try. I promise that I'll try, but I can't promise that I'll answer absolutely everything.